concentrating on breast cancer, cervix cancer, colorectal cancer, and oral cancer, and liver cancer early detection studies conducted in countries like China, Philippines, Thailand, India, Zambia, Zimbabwe, and among other countries in this presentation.
What are the lessons learned from low and middle income countries?
We have learned quite a bit from these studies. These are all big studies involving several thousand people, followed over several years. They have clearly shown what works and what doesn't work. For example, in the case of cervix cancer, visual inspection with acetic acid and HPV testing are certainly helpful in reducing incidence and mortality. In the case of breast cancer, clinical breast examination certainly results in the detection of almost 2/3 of the cancers in very early stages like stage 1 and 2A. In the case of colorectal cancer, we have shown that this can be the immunofecal blood testing can be readily integrated in health services and can detect precancerous lesions and stage 1 and 2 colorectal cancers, which have very high cure rates. But on the other hand, there's no point in screening for liver cancer. Even if you detect disease very early, it doesn't help to reduce mortality and improving survival. Preventing with hepatitis B vaccination, hepatitis C control are the important interventions for liver cancer control.
Do you think there is anything interesting for high-income countries?
Certainly, there are a lot of interesting findings which have application in high-income countries. For example, in the case of socially disadvantaged populations in Canada, United States, Australia, Europe, and all these high-income countries can follow some of the interventions which have worked in the low middle-income country evaluation settings. For instance, visual inspection with acetic acid, low-intensity screening with HPV testing, clinical breast examination in the case of breast cancer, oral visual inspection in the case of oral cancer screening. And all these have high relevance in screening women and men in high-income settings. It has also shown that programs can be done more efficiently and cost-effectively in high-income countries, provided some of the lessons from the low-income country studies could be applied in the high-income settings.